Right, good evening everybody, and welcome to this month's meeting of the Customer and Corporate Services and Scrutiny Management Committee. I'm just going to very quickly take us through how the meeting will work, just in case you've stumbled across us on some kind of a YouTube odyssey and you've never seen it before. I think most of us now are fairly familiar though with how these meetings work. So I've asked all of the participants that you can see on the screen, all of the councillors, to indicate when they want to speak by raising a blue hand, which is visible to me as the chair of the meeting, but not visible to members of the public. If they're wanting to make a supplementary point or come in on a particular topic that's being discussed at this exact moment, I'll ask them to raise their hand physically and try to bring them in at that point. But otherwise, I've asked them to stay on mute for the duration of the meeting unless they're speaking. Throughout the meeting, we'll be joined on screen by two officers. We've got Dawn Steele, who's the Head of Civic and Democratic Services, and Janie Berry, who is the Director of Governance and the Council's Monitoring Officer. They'll be with us throughout the meeting, but as we get through different points of the agenda, there'll be other officers joining us to give us presentations and to answer questions, and I'll be introducing them at each point as we move through the meeting. I'll be looking to take a short adjournment after about an hour. I'm hoping that the meeting this evening won't go beyond a couple of hours, but if it does start to get any longer, I may look to take a second adjournment later on in the evening. We do have quite a lot to get through this evening, so I'm going to slightly have to play that one by ear. The other thing that I just want to make a note of is we have had a permanent change to the committee's membership. So Councillor Barnes is no longer a member of the committee, so I'd like to formally record our thanks to Councillor Barnes for his contributions over the last 18 months or so, and I'd like to formally welcome Councillor Kilbane, who is now a permanent member of the committee, and members will know that Councillor Kilbane is also the chair of the Economy and Place Scrutiny Committee, and I think, again, just to sort of note, I think it's really helpful when we do have the chairs of the various committees as members of this committee to be able to make input as and when we're discussing things. So moving through, I haven't received any apologies for this evening's meeting, so I'll go straight on to the first formal item of business, which is declarations of interest. Do any members have any interest which they wish to declare? I'm not seeing anybody. So that's great. Move us on to agenda item 2 then, which is the minutes of the meeting. We've got 2 sets of minutes to approve from last month. So that's both the 2 p.m. meeting and the 5:30 meeting. I've just got a couple of points that I want to raise. So I'll just go through those, and then if anybody else wants to indicate as well. So just on the 2 p.m. meeting at minute 26, Councillor Rowley and myself, it records that we declared a prejudicial interest as school governors, but actually I think that should read as personal interest. It wasn't prejudicial. I would also note I did have a quick conversation with Dawn just before the meeting, and actually, because both of us have those on our register of interest normally, we don't necessarily need to record them in a meeting every time. So, you know, just a bit of a judgment, but as I say, on this occasion, I think we probably didn't really need to register them. So that was it for the 2 p.m. meeting. I also just wanted to raise on the 5:30 meeting, just at minute 36, which is on page 10, the third paragraph down reads that members inquired about the possibility of meetings being conducted face-to-face, and I think it would be a better reflection of the meeting if it said a member inquired. Sort of small point, but I didn't want to give the impression that the entire committee was trying to make that point. So if members are happy with those 2 minor amendments, I will then sign those both sets of minutes. If you could just give me an indication by a wave of a hand or a quick nod, that'd be great. Fantastic. So I can move us now on to agenda item 3, which is public participation, but that will give me a very short-lived item because we don't have any public participants registered. So straight on then to agenda item 4, which is the update from public health. Now, unfortunately, Sharon Stoltz wasn't available to join us this evening, but we have got Fiona Phillips, who is the Assistant Director of Public Health, and if she could join us on screen to give us an update on the current situation in the city. I did ask 1 or 2 points for her to raise, but I'll let you perhaps give us a little overview and then invite members to ask questions. Thank you.
Thank you. Yeah, I've got some slides to share as well. I think sometimes it's easier for to kind of relate to figures and things when you're seeing them on slides. So hopefully you can see those.
Yep, okay, got those.
Yep.
Thank you.
Okay. So I'm just going to run through then in terms of what the data, various data sources are looking like currently. So this first slide just gives you a bit of an overview in terms of how cases have played out really since the beginning of this, back to the first 2 cases that we had at the end of January. So you can see that kind of first peak we had in April, May, where we had our first national lockdown. Cases after that were then very low, sort of through July and August. Obviously, what we've seen since the start of September is cases going up both nationally, regionally, and in York. And in October there, we entered into the tier 2, which was a high risk category in York. What we've seen since then is that the numbers have started to come down in York, and then obviously we've gone into that further national restrictions in the last week across England, and we hope that we'll continue to see the numbers go down. I think probably the point to make about when we're comparing numbers from back in April, May to numbers in September is obviously the testing regime was very different in those 2 periods. So back in April, May, you really only could get a test if you were in hospital. With COVID, we didn't have the drive-through test sites, etc. So just to kind of really make that point. This is a bit of information about care homes and what we've seen in the care home setting. So this is the number of care homes where they've had at least 1 or more positive person with a positive test result. So back in again April, May, we had maybe sort of 16, 17 of our care homes who were all dealing with positive cases and outbreaks in those care settings. Those numbers came right down, and in August and early September we had no care homes with positive cases. What we're starting to see now is that we do have care homes where they are recording either staff or residents who have tested positive for care homes. But just to put that into a little bit of perspective, what we have been doing since the end of August is routine whole site testing in care homes. So on a weekly basis, all staff are tested, and then on a monthly basis, residents are tested. And what we're finding is that we're picking up asymptomatic staff or asymptomatic patients. So these are not people who are unwell with COVID, but they're coming back with positive test results. The situation currently today is that we have 1 care home in York where they do have symptomatic residents and they're managing that outbreak. So we're still seeing it as positive in York in terms of the low number of symptomatic cases in the care home setting, and continue to work closely with those care homes to make sure that they've got all the support they need if they do get any symptomatic cases, so that they're managed. So clearly we saw a number of positive cases going back, when universities and schools went back sort of September, October. So just to give a picture of what has played out within the university setting. So these are the numbers that both York, St John and the University of York report to us. So these are staff and students within their university settings. So they may not all be York residents, but clearly what we saw is when universities came back, we had an increase in numbers testing positive. Now that was, partly because students were forming new household groups, and as we know, some of those households, you might have a household consisting of 15 or 20 people if it's a halls of residence, for example. So what we saw was that a lot of those positive cases were linked to having a positive case within a household setting, and then once one person had it, it kind of spread within those households. So after sort of about 3 weeks of the universities being back, what we then started to see was cases going down, and they've continued to go down. Again, just looking at how the situation has played out in the school setting. So this is on a week by week basis from the start of September, and this is just in terms of primary and secondary age children within York. So we saw few cases through the first few weeks of school, sort of maybe 2 or 3 a week in each of those settings, and they have slowly risen, but still quite low. So for any 1 week, 13 in a secondary school setting isn't the most that we've seen across the whole of York. So fairly low numbers. We are in regular contact with all the schools. They report cases through to the Department for Education helpline, but they also let our public health team know when they have positive cases. And our approach really has been to support schools to undertake contact tracing so that we don't automatically send a whole class or a whole bubble home, but we actually kind of take a more risk-based approach, and we actually identify those children who meet the definition of a contact and advise that they isolate if they have been in touch with someone in the school who's been positive. What we've seen is that there's not been much evidence that there has been transmission within the school setting. So where we are getting pupils who have tested positive, it generally has related to either somebody else within their household, a parent, for example, has tested positive, or it's been a social event that they've been to outside of school where there's been a positive case. Just going on then to look at what's happening within the hospital setting. So number of hospital patients who've tested positive has been increasing. These are mostly patients who are in general and acute beds within York Hospital. So that's the little orange dots there that you can see going up. One of the things it's worth saying though is that these are patients who are in hospital who test positive for COVID. They're not necessarily patients who have COVID in the community and then are admitted to hospital. So all patients, when they're admitted into hospital, are routinely tested for COVID, and then some of them will test positive. And so the line, the pink dot you see along the bottom is probably a better indicator of severity. So those are the patients who are in ITU with COVID. So that has remained quite low, and we'll continue to monitor that and hope that it stays that way. Looking then at deaths, so we've been monitoring these throughout the course. So the red line along the bottom is deaths where COVID has been reported on death certificate throughout the course of the year, and we've been comparing this to all deaths in York residents using the years 2014 to 18 as our baseline year, and kind of monitoring what the deaths this year are looking like. So you can clearly see when we had that peak of deaths in sort of May time, that coincided with that peak in deaths overall across the city. So we haven't seen any real peaks like that at the moment. But obviously, again, that's something that we're closely monitoring that. But just to give you a bit of data around testing. So on the right-hand side, these are the number of tests that are carried out on a weekly basis. This graph starts from the start of July. And pillar 2 is those tests that you can get done either at a drive-through centre, a walk-in, or through ordering a home testing kit. We can see they went up. They're now starting to come down a bit. And then the graph on the left is our positivity rate. So for all the tests that are carried out, how many of them, what proportion come back positive? So we saw our positivity rate peak sort of at the end of September, and it was up to about 18%, which was a worry to us. And we'd gone higher than the regional and England rates. That has started to drop down now, but again, it's one of those key indicators that we will monitor. The World Health Organization advises that you should have a positivity rate of around 5%. So that would be ideally what we would be wanting our rate to look like. So we've got a way to go there. Then in terms of contact tracing, so the National Contact Tracing Service launched at the end of May. So this shows the number of positive cases that have been entered into the National Contact Tracing Service, and then the line running along underneath that is the proportion that that service has been able to make contact with. So this is just that in a bit closer detail. So on average, that national team has been able to get in touch with 78% of cases. We then launched our own local contact tracing service on the 22nd of October, whereby we've been following up the cases that the national team has been unable to get in touch with. So in terms of how that service has been going, this just gives a bit of data in terms of successful completions. So overall, we've successfully been able to contact 82% of those cases that the national team has been unable to get in touch with. We are currently operating on a Monday to Friday basis, but as we get more staff in place, we'll be looking to do that over a 7-day time frame. And just to give, it's probably a bit complicated, but one of the things that we're trying to do is get comms out there and advice to people about how the app works, the NHS app works, how that works in relation to the National Test and Trace Service, and then how that links in with what we're doing locally. So I think the thing to say about the app is that that's a good early warning system for people. So it tells you that you've been near a contact, or you've been in contact with somebody who has tested positive for COVID. What the app can't do though is, it can't tell you if you were in a work situation where you were behind a perspex screen, or if you were wearing PPE, or any of those kind of nuances about the situation you were in. So it's a good sort of indicator that you're potentially at risk, but then individuals will need to sort of work back and think where they were at the crucial time, and make that sort of judgment in terms of whether they were indeed at risk. If a person tests positive, as I say, they get followed up by the National Test and Trace team. That service for our York residents will try for 2 days to get in touch with people, and they'll make up to 10 calls. So obviously you hear people talking about getting multiple calls from NHS Test and Trace. So obviously if people are able to answer those calls, that would kind of stop that journey. What that service also does initially is that they offer people the opportunity to go online and enter details of their contacts online. So obviously if people are able to do that online, that would then stop them receiving those calls. As I say, when they're unable to contact, they pass that to us, and then we will follow up firstly with a text message to let people know that we're going to be calling them, and then we follow up over the phone for a day. And if we're unable to make any contact with them, we will then do a home visit and try to have a conversation with them, or leave some information with them at their home address, really just to emphasize the importance of them knowing that they need to self-isolate, and also the importance of getting details of any close contacts that they've had. And then the other thing, importantly, about our local contact tracing service is making sure that people are aware where they can go to if they need support to isolate, and how they could access some of the financial packages as well if they're eligible for that support. So then finally, just thinking about what's next, and this is a bit of a guessing game sometimes as to what will happen next. So as we understand it at the moment, the current lockdown will end on the 2nd of December. Towards the end of November, there will be a review of each area to determine which tier an area will go into. And those indicators that I've put there on the slide are what we understand will be looked at in terms of determining which tier an area will go into. So we entered lockdown in tier 2, so whether that will be the same at the end of lockdown, or whether that tier will change for us, we don't know yet. And obviously we'll be monitoring these data sources as well to see what we think that might mean for us. But what we don't have yet is what criteria are being used, particularly by the government. So we can't sort of 100% say, right, okay, we're under a certain threshold for that indicator, therefore we'll be in tier 1, 2 or 3. The other potential element that may be coming our way, obviously we're doing contact tracing now. Whether more contact tracing will be passed over to local areas, that's a possibility. So we'll be making ourselves prepared for that. And then, you're obviously aware of the various pilots that are going on around the country. Liverpool is a good example where they're doing testing out some of these new testing technologies, lateral flow testing they call it, which is a very quick self-administered almost like screening test, and testing out how those are delivered in whole cities. So we expect that there will be a rollout of that type of testing technology across all areas in England, so we'll be preparing for that. So that's kind of the end of my presentation. So happy to answer any questions.
Thank you very much for that. That was really, really helpful. And I was sort of watching you going through, and I was thinking, I chucked across a bunch of questions to Fiona earlier in back end of last week, and I think she pretty much answered everything that I'd asked. So that's a great start. I've got a few people with their hands up. I'm just going to take you in the order that you've put your hands up. So first off the bat was Councillor Rowley.
Thank you, Chair. Fiona, thank you ever so much for that information. It really is helpful. I just wondered, you gave us a slide with the overall total in York of positive cases, and obviously with the spike in September. You then gave us a slide with the university numbers, which was really, really helpful. Would you be able to give us some figures with those university numbers stripped out from the overall total, just to give us some indication of how prevalent in York from how can I say, indigenous York folk, as opposed to the students, just to see what effect that is?
Yeah, it's not quite as easy as that, because obviously, the figures for the universities, they're not all York residents. There's quite a lot of students who commute in from surrounding areas. So if I just took the numbers that the university have shared out of our numbers, it's not a true reflection. But so it would be a bit of an estimate, really. I mean, clearly numbers in student cases have contributed to our overall case numbers in York, but it's not the entirety of the picture. So the other thing that we do is we look at cases by age band. So if you kind of, very roughly sort of take that sort of university age of York resident, you can see that there are an increase in that age band, but obviously not everybody in that age band is a university student. So it's, you know, you're kind of trying to estimate a little bit. So it's hard. I don't think I could do that accurately, really. If yeah.
Thank you. Councillor Musson was next.
Thank you, Chair. Thank you for the presentation, Fiona. I think what's particularly encouraging is the local test and trace service starting, because I, to be honest, have much more faith in that than some of the national stuff, particularly in light of the news story that the test and trace app threshold for advising people to self-isolate was set incorrectly for quite a while, which I think worries me. So having something local in place that we know is more sort of informed to give people advice and the correct advice is really encouraging. I wondered if you had any data or had plans to collate any data on infection rates in further education institutions. I know, again, you can't really work out whether these people are resident in York, because a lot of people who attend further education commute in, but is there any information on that? Because that would be quite helpful, I think.
Yeah, so we do, so I've presented you the details at the two universities, but we do also collect that data from York College and from Ask and Brian as well. So they do supply that information to us. I haven't presented it because it's quite small numbers, so it doesn't contribute to the overall picture in York quite as much, but we are certainly monitoring that and working closely with those institutions as well, just to support them. I mean, I think the thing to say is that the universities and the colleges have done a huge amount in terms of, you know, they're basically doing contact tracing in their settings when they get a positive case, and we've, you know, given them some support initially with that, but they're now essentially doing that work and making sure that their students understand that they need to isolate if they're a case, or if they've been in contact with someone that they need to self-isolate. So they have done a huge amount of work to really support what we're trying to do in public health.
Thank you. Next, I have Councillor Mason.
Thanks. I've got three questions for you, Anna. So I'll read them all off, and then if you can answer them at your kind of leisure, whichever one you want to answer first. One of the charts you showed us had number of ICU beds. I think it was the bottom one, which obviously looked like small numbers. Obviously, we all know that ICU beds are a limited resource, and obviously, especially with a trust like York, which covers Scarborough, and how resources are shared across the whole patch. So I wondered if you had that as more of a kind of percentage of how much of ICU is being taken up with COVID patients. The second one was about local track and trace powers, and obviously the National Track and Trace Service, if they tell you to isolate and you don't, then you're liable for a fine. I wondered if the government had passed that power on to us, in terms of if we tell someone to isolate, you know, is it still the same in terms of, can it be enforced like the national system? And then the third one was really about, and I think you've touched on it, really about new technologies, and I've had some experience of that at work now. And you know, what do you see us kind of lobbying for next in York, or what else does York need? So hopefully you can remember all those to answer them for me.
Yeah, so I think in terms of the ICU bed capacity, then yes, you're right, that's probably the more important thing, you know, whether the hospital is reaching capacity. So I can't tell you that off the top of my head, but we certainly do receive those figures, and I could provide them through to you. My overall picture at the moment is that they do have capacity. So we're not at that point where we're saying that the hospital can't cope, but obviously we know there are other hospitals in the region that are reaching that point. So, you know, we'll continue to monitor that. In terms of powers around self-isolation, then yes, under the Coronavirus Act 2020, we can use that power around isolation. So we haven't used it as yet, and our approach is to advise people and give them the reasons why they need to self-isolate. But obviously, if we are made aware of people who, are continuing to go to work or something like that and are not taking that advice, then we do have the powers around enforcing that isolation, and it would be a fine for people if they don't isolate. And then in terms of new technologies, well, yeah, it's difficult to know. I mean, I think, clearly the testing, the advances that they're getting in testing, seem interesting, but at the moment, they also come with challenges in terms of, how accurate they are, whether you then use that testing as a screen and then you still have to do PCR testing. So there's a lot of detail that we need to work out and learn from the areas that are currently piloting it, but potentially could be a good way of us managing the situation. Clearly, the biggest technological advance that could come along would be a vaccine, and that would be the number one thing to have. Really, is an effective vaccine, and we are already, working on our mass vaccination plan for the city. So we're looking at how we would, once the vaccine comes along, how we will get through the population and set up sites, a bit like the flu mass vaccination site that we've currently got. So, but to do that on a bigger scale once we have a COVID vaccine. So that's definitely something that we're working on. But, a lot of it comes down to the resource to be able to deliver this. So that's, something that we always, need support in terms of lobbying for the right resource to deliver these interventions.
Thanks, Fiona. I'd just like to ask you a quick supplementary, actually, just around the ICU and the admissions to hospital. And it always seems to me that the bit of data that's missing is the discharges from hospital. And is that something that we collect as well, or that we can access? I appreciate what you're saying about people being tested for COVID on the way in and not necessarily being admitted because of being, COVID positive. But it just seemed to me that was quite a key thing in terms of trying to work out the capacity within the hospital.
Yeah, and that was one thing that you did ask me about that I didn't report on, because when I looked, we did used to report on that, and that was kind of in that situation where it was really only people, you only really knew if someone was COVID positive when they were in hospital because they'd been admitted because they had symptoms suggestive of COVID. And so at that point, when it was the data was like that, we were then reporting on and then what happened to those patients and where they discharged. But because it's much more a mixed picture now of people who happen to be in hospital and happen to be positive for COVID, we've stopped doing that reporting, because their discharge isn't necessarily because they've recovered from COVID or not. It's it's more about them recovering from the thing that they were originally in hospital for. So it's a bit more difficult, but I can sort of have another look and have a conversation with colleagues to see if there is anything that we can do to give that picture, because I know when we were doing it originally, it felt an important thing to do to give some of those positive messages. So I'll take that away as an action to look and see if there's another way or other data that we can have to do that. I think one of the other things actually that has come up, which again I don't have an answer for, but it's something that's on our mind, is people talk a lot about people with long COVID, as they call it, and so trying to see if there's a way that we can monitor what proportion of our population are reporting ongoing symptoms with COVID sort of several months after being initially diagnosed, just to get that kind of picture of ongoing impact on our population.
Yeah, I think both those things would be very helpful.
Yeah.
Councillor Kilbane.
Thank you, Chair. And thanks, Fiona, and congratulations on the success of the track and trace local team, which seems to have had an almost immediate impact on controlling the virus here. If only we'd had some of that 12 billion that went Serco's way earlier in the year, who knows where we could be now. Apologies for my question if you've already answered it, because my internet dropped out at the crucial part of your presentation. And it's around, sort of relates kind of to what Councillor Crawshaw was just asking. So, I mean, I think first of all, what would be interesting to know would be the death rate from COVID in York compared to national. Some more people survive it here or not, and what the death rate was overall. But my question is about excess deaths and where are we in terms of year-on-year, 5-year averages? Are we likely to have a lot more excess deaths this year, or are we already having them, or where's it sat? I don't know if you know the answer to that question sort of here, or even if you've given it already while my internet was off.
Yeah, you might have missed that slide. So I did show a slide on excess deaths. So what we saw, it was in kind of April, May, we saw our peak we saw our deaths go quite a bit higher than the baseline years of 2014 to 18 that we've been comparing it against. We've not seen that really since then. And in terms of our death rate compared with England, we are below the England rate, but clearly it's, you know, an important indicator that we'll keep looking at.
Go on, Councillor Cobain.
Thanks. Yeah, I guess what my question is, are we likely to have more or less deaths this year, really? Are the deaths going to average off? You know, the thought that maybe people who are susceptible to COVID died earlier in the year than they would have done later. So where we're going to be sort of overall?
So I think maybe that isn't going to be the case. That was, you know, our hope maybe at the start of the year, so that when we saw that peak April, May, what we'd see now is that our excess deaths were below what we'd normally expect. They're tracking about the same as what we'd normally expect. So if that carries on by the end of the year, that peak we saw earlier will remain as a true increase in deaths this year.
Thank you. So I've got Councillor Hunter next, and then I'm going to look to wrap up this section. So if anybody else is wanting to ask a question, if you could just indicate now, but Councillor Hunter, please.
Thank you, Chair. And thank you, Fiona, for an excellent presentation. And it's so good to see the numbers actually coming down. And again, thank you to all the public health team for all the great work that you're doing. My question's regarding the care homes. You said the numbers are going up. Do you happen to know the source of the new COVID cases in our care homes?
So, like I say, most of the cases that we're picking up are asymptomatic. So what we're finding with residents is that we're having a number of residents who tested positive back in, you know, maybe May, June time. They're now being retested and they're coming back with positive results, but they're not symptomatic. And what you find, so the guidance is that you don't test somebody again within 90 days of initial infection. But what we know in older people is because the immune system's not quite as effective and it takes a longer time for that virus shedding to happen, they're still showing a positive result quite a bit after the 90-day exclusion. And then for those staff that we're picking up as positive, again, mostly asymptomatic. So it's hard to kind of know where that infection is coming from, whether it's possibly previous infection that they have had. We've certainly, some of the issues that we picked up earlier in the pandemic, which was about, you know, maybe care staff sharing lifts to work. They now don't do that. They're very cautious about that. So they follow that advice to not share cars and traveling to work. Things like working in multiple care homes, that's kind of reduced now so that we don't have that sort of transmission with staff. So it really just is one of those things that, you know, it seems to be mostly asymptomatic and could potentially be previous infection.
Thank you very much. So I've just got Councillor Fenton, who's indicated if you'd like to ask your last question.
Thank you, Chair. Just coming back to the situation in hospitals, is it the case that the cases that are being picked up in hospitals, do they relate to emergency admissions? Because I know that for elective care, there's a process that patients have to go through in terms of undertaking a test before they are admitted for an elective procedure. So is it the case that the cases we are finding in hospital relate to people who've been admitted in an emergency, where obviously there wouldn't have been that pre-admission test because obviously the admission isn't planned? Just wondered if my assumption on that is correct.
Yeah, I think that's right, because like you say, if it's an elective, then they would be tested prior, and if the test came back positive, then that would obviously halt that elective procedure happening. So these tend to be people who've ended up in hospital not planned, but then they do the test whilst they're there and it's coming back positive. So and obviously that creates challenges for the hospital in terms of how they manage those patients, and having to have kind of, what you term hot wards where they have COVID positive patients. And, so I'm not sort of downplaying it. Obviously, it's still a challenge for the hospital.
Thank you for that, Fiona, and thanks again. That's been a really helpful presentation. I think just as a committee, one of the things that we discussed last month was possibly having a sort of a dashboard or a sort of set of KPIs around some of the COVID stuff that we would, rather than ask for a presentation or an update necessarily every month, we could just get an updated set of figures that we might want to then ask some questions around. I was trying to keep a note of the types of things that we were asking questions on throughout this section. So what I'll do, I'll just sort of rattle them all off, and then perhaps invite you to send me a message after the meeting if there's anything that you think I've obviously missed. And then if we get a compiled list of things together, then for future meetings, it might be, I think, perhaps prudent just to kind of have a list in advance of these are the types of things that we're looking to get information on, and then anything that seems to be an outlier or seems to be going in one way or the other more dramatically than it perhaps should be, then that gives us a steer for what we want to look at. So aside from the kind of overall things around COVID numbers and what have you, what I was jotting down was things like the percentage of contacts on test and trace, the number of care homes with one or more positive test, the numbers for students at York University, York St John, and possibly the further education settings as well. I think having just an overview of the numbers of primary school and secondary school cases is helpful, and then those things around admissions, the ICU capacity, and possibly any information that we could get around discharges as well. And then I think the positivity rate is something that's useful to be looking at. And then obviously I think just in general the things like the pillar 2 testing and the overall rates as we were. I think that's pretty much everything that we've asked questions on this evening. If I've got anything glaringly obvious missing, give us a quick wave. Otherwise, I'm not. See, oh, Pete's. I knew you'd pick me up on something. Go on, Councillor Kilbane.
Excess deaths, please.
Excess deaths, yeah. And if anybody thinks of anything afterwards, if you could just pop me an email, and what we'll do is try and collate all of that together and see what we can get together as a bit of a dashboard going forward. So thank you very much for that, Fiona. That's fantastic, and you're now free to leave the meeting. Obviously, very welcome to continue watching afterwards if you wish to.
Thank you.
Thank you very much. And I'll move us on now to agenda item 5, which is the update on the council's overall position further to COVID. And Ian Floyd's joined us now. So good evening, Ian. And just to give you your new title, is Ian is the newly appointed Chief Operating Officer and the Head of Paid Service. So over to you, Ian, if you could give us an overview on where we are corporately and how we're looking for the weeks and months ahead.
Hey, thank you, Chair. And I would just say in terms of your last point, we do have a lot of information which we are keeping. I mean, not just on the public health data, but actually a lot of information in terms of how we are dealing in terms of the recovery, universal credits, lots of information in terms of the impact on businesses. So it might be that we can maybe add some of that information and let you see what you might find to be relevant. I think I'd start just by saying that dealing with the impact of COVID very much remains clearly, the number one priority and issue for the council. It still consumes clearly a lot of officer time, involves lots of ongoing meetings with sort of health partners, regionally with other councils, Public Health England, government, lots of management team time. And I think looking ahead, I think it's also important to stress, even when it's over, and clearly, potentially some good news today, the impacts of this will be felt one way or another for a long time. And I think we need to recognise that as we move forward. I think it's also important to stress that the council's response to this has very much been cross-organisation. It is a public health crisis, but our response to the council very much touches all areas of the council activity. I think just picking up on what Fiona talked about, I think there's a couple of things which I would add to what she said. And yes, it is positive in terms of York and the case numbers. Ours are going down, as you saw in the charts. Across Yorkshire and Humber, our rate is the lowest in terms of local authorities across all of those authorities. And so that is positive, albeit we can't be complacent. And you can get that sense of why we can't be complacent from actually looking at some of the other areas, particularly in the Humber area, where cases are rising rapidly, having been, probably the lowest in the region for some time. And I think one of the impacts from that is clearly if you have significant rises, for example, in the Humber area, that can then start impacting in terms of the effects on, for example, York Hospital as well. So there are some glimmers of hope, but equally we need to be very careful and mindful as we move forward. I think just turning to our staff, and Trudy will pick up on some of this later on, but I did just want to say a few words because I think clearly the crisis has affected our employees in one way or another. So it affects them all effectively in work, whether they are still working in the communities but in a different manner, or whether they are working from home. And those who are working from home have done so for nearly 8 months. That is a long period of time. And even if we move forward in terms of, news today, vaccines, the likelihood is this is going to probably have lasted at least a year. And that has an impact clearly on a lot of our employees. It's a long time to be dealing with a crisis. It's a long time to be working from home, or it's a long time to have been doing things in a very different way. It also impacts clearly on our employees in terms of their personal lives, their home lives, impact on seeing friends, family, doing the things they love. And for that reason, clearly supporting our staff and their well-being absolutely remains a priority. So alongside, giving the staff messages in terms of public health, we give regular updates in terms of how they can look after their own well-being, what support and advice is available, and good practice. And we do a all staff email 3 times a week. We supplement that through staff sessions. We do some Facebook Live events with staff, and also constantly we reinforce through managers the need to engage and to listen to staff, and to encourage people to raise questions, and also raise the fact that if they are struggling, there's nothing wrong with people raising those issues, and we'll try and help and support. Clearly, as Fiona touched upon, we continue to push messages out through our comms to residents, businesses, to really keep enforcing the message. And I think that's critical, even though cases are going down. We are only getting some of that down through a lot of hard work across the organisation. I think the other thing I would say is really across the organisation, we continue to work well. So different parts of the council assist greatly other parts, but equally work across with our partners, with the health sector, the work of the universities, and Fiona has mentioned that, and I would pay tribute really to the work the universities and colleges have done and how they have worked very openly with ourselves. I think, throughout this crisis, there are a lot of, negative issues clearly, but there are some positives which I think we do have to take forward. And one of those for myself is actually the strengthening of the work with our partners. So the work with universities, with the health sector. I think that places us in a good place moving forward to actually then how do we progress some of the things in a post-COVID world. Other issues, I think, which are relevant, clearly Debbie will give you an update on our finances, but clearly that is critical, and that will affect to the extent in terms of, how we can maintain services, what we may need to do differently, and how we can, respond and support our communities and our businesses in the longer term. The economy, clearly the current lockdown is going to have further impacts. We've done a lot in terms of trying to support businesses, and obviously you've heard at previous meetings about some of that. And we were shown some good signs in terms of the York economy. Clearly, that's a bit on hold in the current situation. But I think it does give some optimism that actually if we can come out of this, York can respond, and our businesses can adapt, and York will still remain a place that people want to come to. We are starting to get business grants, new business grants out, so we need to process those again, so significant activity in relation to that. We have, during lockdown, some additional responsibilities in terms of the clinically vulnerable, so our community hubs are up and operating again. Clearly work continues with schools, so it is very much a whole council effort, and I can't thank staff enough. There is no let up in terms of the response, the demands, the pace of the work. The commitment shown across the whole of our employee base is absolutely incredible. But I would just reflect that, this has, as I say, been for 8 months, with some more months to go. So, it is inevitable that some staff are incredibly tired. We do try and, tell people to take breaks, take leave, but there is no doubt that, staff have been working incredibly hard during that period. I think the longer term impacts of COVID, though, I think this isn't just about getting through this crisis and then coming out of it. Those longer term impacts I wouldn't underestimate. The impacts on communities, on our residents. Clearly some businesses will not survive, and then you have a lot of the emotional impacts, and also clearly issues in terms of mental health as we come out of it. And you do experience sometimes in a situation where people's focus has been so much on dealing with an issue, which in this case is clearly COVID, that if you do then eventually come out of that, actually some of the challenges that you face can equally be as hard. So clearly lots in terms of the COVID impact, it remains the number one issue and challenge. I think it's worth just saying clearly throughout this, we also now clearly are doing, business as usual. This lockdown feels very different from the first one. Clearly not everything is shut down. We're also in a better place in terms of dealing with things. But I think also it is fact that, we haven't stopped really anything. So a lot of the basic service delivery, which had restarted, continues. All that, work that people do on a day-to-day basis, plus major projects, how we move forward priorities, that is also continuing. Just two sort of final issues I think I would mention, slightly different issues. Obviously, devolution and local government reorganisation. Clearly that was debated at full council. And so the submission for our response was today, and that has gone in. Clearly the strategic partnership is coming to corporate scrutiny for some discussion as well. And then finally, just to mention, obviously we won't go into any details for obvious reasons, but clearly we are also doing a senior management review of structure, clearly following my appointment, plus the fact we've got 2 other chief officer vacancies. We needed to review the senior management structure, both to obviously make some tidying up where it was necessary, but also I think to position it and make sure it's fit in terms of how we come out post-COVID and respond to the many challenges which as a council and as a city we will face over coming months and indeed years. I'll stop at that point, Chair.
Thanks for that, Ian. That's really helpful. I was going to just open up to questions, but actually, as you've just raised the point around the restructure, and I did have a couple of questions that I wanted to pick up with you about that. So I think it'd be appropriate probably for me to just ask you quickly now, and then I'll invite members to ask their questions. And the first one really was just, it's difficult to ask you, but I think it's important just in terms of moving forward. And obviously, there was some controversy around the appointment to your position, and some misgivings were raised in full council. And I think it's very important that we move on as an organisation, rebuild trust, and make sure that there isn't reputational damage around that. And so I would just like to know what steps you'll be taking as the Chief Operating Officer to just reassure members, reassure the public that we're operating as a functional organisation, and are moving forward in a constructive way, shall I say?
Well, I think we've demonstrated as a council how effective we can be the last few months in terms of how we deal with the pandemic. I think in terms of what one of the strengths of that has been the cross-council working, breaking down any silos, making sure we have the right culture, people operating effectively very much across the whole of the council and responding to our communities, our businesses, and liaising with elected members as well. How we go forward, I mean, my view is that we need to go forward. Ultimately, our job is to serve our residents, our communities, and that's where my priority will be. That's where I'd expect chief officers and organisations' priority to be, which is to deliver the best possible services we can to our residents, to our communities, support business. And clear, as I said, we have some huge challenges to face, and we need to operate as one organisation at the officer level. But also I think politically, and yes, you do have differences of political view, that's natural, you're always going to have difference of opinion. But I think the one bit that you tend to find in all political organisations, all elected members, is it's about trying as best we can to serve our residents. And people have different views as to how you do that, but ultimately I think that aim is shared by officers and members alike, and you only get an effective council by having good relationships, trust, openness, discussions, both at the officer level, but also at the officer and member level.
Thanks, Ian. I appreciate that response. And the other question I just wanted to ask you, as you touched on some of the interim arrangements around the structure at the top of the council, and I appreciate not wanting to get into any individual particular positions or anything like that, but I wondered if you could give us an indication of how long you anticipate the interim arrangements to last for. And I think specifically, just because I think on this particular issue, it is important that we have some challenge and discuss, publicly. My personal real concern, as I'm sure it is for everybody else, is around safeguarding of the vulnerable people in the city, whether that be children, whether that be vulnerable adults. And so I guess the second part to my question is are we happy that we have sufficiently robust systems in place for the duration of those interim arrangements, that people aren't going to be in a position where they're falling through cracks or being missed within the structure as we currently have it?
Yeah, absolutely. I think I'm confident that we've got the arrangements in place to do that. We wouldn't have implemented that structure if we didn't think that was the case. Clearly, I have certain responsibilities, but also clearly the Director of Children's Services has responsibilities for that as well. So I'm confident that it's safe. We envisage, in terms of permanent structure, we envisage a report coming to Staff and Matters early December. That would then lead to a process being undertaken where obviously you look to go through the necessary HR processes. And so my intent is to move to a permanent structure as soon as we can. What I would say on the safeguarding is I'm very clear, and without going into the details, clear it would not be right now, I'm very clear that that's an area the council has to have adequate resourcing. It has to have a structure that is resilient. It has to, in particular, be able to deal with, for example, one person leaving. It can't be left in a place where every time, one member or one senior officer leaves, we're all rushing around in terms of interim appointments and things like that. Because these roles, they tend to have significant turnover. So it has to be strong and resilient. And there are, I'll carry it. I said this to a few people before COVID, which was there are two things that break an organisation generally. One is your finances, the other is children's services and safeguarding. And the priority, be under no doubt that I place a huge priority in terms of having effective safeguarding both for children's and adults. And any local authority who has those responsibilities should absolutely place them at the forefront in terms of their priorities. That's what we're here to do.
Thanks, Ian. It's great to hear you say that, and I wouldn't have expected any less. But great to hear it nonetheless. And thanks to the committee for indulging me in those couple of questions before I open it to everybody else. So, I've got a few people who've indicated that they'd like to ask questions. I'm just going to take you in the order I've seen you. So, Councillor Rowley, you were first up.
Thank you, Chair, and thank you, Ian, for your report. In the light of the fact that last week saw the first arrests for furlough fraud in the UK, this government has thrown hundreds of millions of pounds at businesses and relied upon local authorities to distribute it. Given the fact that we're in a new lockdown and there are new business support grants available, what checks and balances do the council have to ensure that the recipients of those grants are entitled and that those grants are being received in a good and proper way?
Yeah, I mean, it's a question Debbie might want to answer later in terms of the specific details, but we do undertake checks in terms of it. We have involved Verito auditors in terms of how we processed some of those grants. So we absolutely recognise that there is that risk of fraud. I think the steps we have taken previously in terms of distribution of grants have done the necessary controls. Clearly, Debbie's Section 151 officer needs to have assurance in terms of those steps, and the customer finance team are well used to, distributing lots of money or collecting lots of money and having the appropriate systems in place. And so I think I'm assured that we have the necessary steps in place to do that. And as I say, the engagement of our internal audit team through Verito, but equally at the same time, we've managed to distribute those grants effectively and quickly as well, because it is important to get that money out. I think some of the difficulties, all authorities have faced is actually sometimes the government guidance has not been ready at the same time as the announcement has been. And that's not a criticism, because we're moving in a fast-paced world, and decisions have to be made, and it's there's no point waiting weeks and weeks to get everything right. But it just is a fact that moving in a fast-paced situation, you sometimes have to adapt and change. But I'm assured that we have taken the necessary steps to get that right balance between counter and fraud, but also getting the money out reasonably quickly.
Was that a follow-up there, Councillor Rowley?
It is, Chair. Thank you. And again, this will be my last question, so we can move on. Thank you, Ian. Ian, my understanding is that the criteria for these new grants is slightly different from the criteria for the initial grants that were distributed at the beginning of this particular pandemic. Given that obviously it was based on your rateable value, and I sense these new grants are as well. But I understand it's a little bit more difficult. It's not an en masse distribution of these new funds. So my question would therefore be, what are we doing as a council to ensure that businesses that might think they're entitled to this grant get to know that they are? What are we doing in terms of an education piece?
I didn't hear all of that question. I think you broke up slightly, and I think you might have muted yourself before I heard the final bit, but I get the gist of it. Again, I mean, it's a detailed question in the sense, and I'm sure somebody like David Walker, Simon Brereton could give you a lot more detail, but we are doing lots of engagement. I think there are lessons learned from the first set of grants in terms of how we can provide advice. There's a dedicated email where people get information. There's information on the website, and if anyone who has any doubts can get in touch with us in terms of any information they may have. The other aspect of the grants is there's quite a significant chunk which is discretionary. So I think about 4 million, we think, will be in terms of the council's discretion. That will have to last for, we understand, till the end of the current financial year. But clearly, developing a discretionary scheme also takes quite a little bit of work through. So that will be coming through to an exec decision session very shortly in terms of a discretionary element.
Councillor Rowley, was that a quick
It is, and
follow-up?
I promise.
Yeah. That's all right. Go on.
My last one. Sorry, Ian. I'm just so as someone that owns a business in York, the council has my email address, as I'm sure other members that run businesses would concur. I haven't received, as a business in York, I haven't received an email communication from the council describing what this new grant facility is. Would it be possible for the council to email the businesses in York just to say, look, this grant is available, and this is how you can check whether you qualify for it?
I'd need to check again. I'm not close enough to the grant distribution system, but I can take that away and just check whether we are doing that or whether we can do that.
Councillor Fenton, was that a supplementary?
If, just to add it, I know I signed up for the sort of business update emails that the council does send out. So that might be something, if there are members who aren't aware of the fact that that facility exists, it might be worth dropping members an email so they can advise businesses how they can proactively sign up to receive that information.
Thanks, Councillor Fenton. And Ian, if you're taking that away, if you could perhaps just give us a bit of feedback, either to Councillor Rowley or to myself, and I can circulate it around the committee, that'd be really helpful. Councillor Kilbane.
Oh, thanks, Chair, and thanks, Ian, and actually credit to Councillor Rowley's party for its wholesale adoption of socialist policies. Long may it continue. It's Ian, just in terms of the senior management review and the new appointments to senior management positions, do we expect the people to be assimilated into those positions, or are we able to externally recruit yet?
Obviously can't go into any specific details, but we would follow our normal HR procedures in respect of any reorganisation.
Is that supplementary, Pete?
I'm sorry, I don't follow. So are we able to externally recruit yet, or will we be looking for internal assimilation?
Well, our process is generally, I mean, it would depend clearly in different aspects of that. So our normal process is if somebody is facing redundancy, we have a duty to ensure that we try and minimize that impact and not cause that redundancy. So if there's a situation whereby somebody's job is being deleted, if there's a role that they could assimilate into, that would be normal HR policies per the council. Clearly, if there is nobody who assimilates to a role, we may recruit externally. And so if there was a post created, for example, as part of a senior management structure, and there were no internal applicants who assimilated to that, we would then move to an external recruitment process.
Thank you. And I've just got one other person. And so anybody else who's wanting questions, stick your hand up now or forever hold your peace. But while you're thinking about it, Councillor Pearson, if you'd like to ask your question.
Thank you, Chair. Yeah, I just wanted to say, Ian, congratulations on your appointment. And I think you had the world's longest job interview. So I think you did a stellar job. So congratulations. My question, I suppose, is during the last lockdown, one of the biggest complaints, I suppose, or queries we got from residents was things like the basic things. It was about tips, it was about dustbins getting emptied, about green bins and all the rest of it. Now, obviously, the green bins are coming to an end for the winter, but what are you going to be doing to ensure that we can continue with those, basic services during the rest of lockdown and through into the winter?
I think yeah, and I mean, thank you for your congratulations. I do share the title of the longest job interview with Debbie, so when she comes on later, so we do jointly share that. In terms of the basic services, that all of that those should be able to continue essentially. I mean, there clearly are some facilities we have to close, so the leisure, the mansion house, and clearly some services have to change slightly. But in terms of those, bins being collected, those things, those will continue as normal. And clearly, the objective is to keep cases down and get out of lockdown early December. And if there is a more regional tiering system, that way we move back into the lowest of those tiers. And hopefully look forward to next year as being a more positive year.
Right, I'm not seeing anybody else indicating any further questions, so I will thank you, Ian, for your time this evening. You're now free to leave us.
Thank you.
Thank you. I think, given the time, I'm going to take a short adjournment now for this meeting. So I make it 6:43 by my clock. So can we make it a quick 5 minutes and come back at 10 to 7, please? If you could all just switch off your video feed, follow the instructions, and we'll see you all shortly. Right, welcome back to this evening's meeting of the Customer and Corporate Services and Scrutiny Management Committee. I'm moving us straight on to agenda item 6, which is an HR and staff wellbeing update. So we're joined on screen by Trudy Forster, who is the Council's head of HR. So Trudy, if I could ask you just to give us a little presentation of your report, any updates, and then I'll invite members to ask questions. Thank you.
Thank you, Chair, and good evening, everybody. I've been asked to provide an update to the committee regarding the ongoing and future activity to continue to support the health and wellbeing of our staff, a key priority for us all, and Ian's already touched on that in his report to the committee. This gives a quick update on the absence figures as well and the day one absence provision, and suggests further areas that as a committee you may wish to consider. It's not my intention to go through the report page by page, so I'll just pick out some of the main bits to mention. So maintaining the health and wellbeing is really important, and the committee's had interest in the health and wellbeing of our staff for some time, but especially so during a global pandemic, and Ian's already mentioned some of the activities the staff have been doing and that ongoing response to the pandemic. We've initiated and maintained some key health and wellbeing activities since March, and on the table shown on pages 14 and 50 give you some more detail around those key areas of activity. So, for example, we have carried out health and wellbeing surveys, health staff information sessions. We opened a staff wellbeing line where staff can contact HR direct, as well as direct contact to HR through email. We've published a lot of information signposted staff to key information supported by our public health team. So we've worked very closely in HR with public health to maintain the health and wellbeing of our staff. We've regularly asked staff for feedback on any ideas that they have as well, to share with us to see if there's some new creative ideas that we've not thought about, and we've responded to them. There's nothing come forward lately, but we have had a positive response from staff regarding the activity that we're already doing and maintaining. We will be doing a next health and wellbeing survey, so follow up from the one earlier in the lockdown, and that'll be launched in November and December with results available early in the new year. Absence management is still very important to us as well, and to ensure that the staff that are unwell to attend work have got the right support to them. Again, in previous committee meetings over the years prior to the pre-COVID, again, this was an area of interest for the committee. The graphs shown on page 16 and 17 do give you that high level view of absence rates. On page 16, it shows that the absence rates have slightly reduced over the 12-month rolling period, but actually during a global pandemic, that's really good to maintain, and that we haven't had significant increase in absence. Economy in place from that has shown the greatest improvement over the 12-month rolling period, with the absence per FTE dropping by around 3.7 days, which is excellent progress and reflects the dedicated work that the Directorate's been doing into absence management. Stress has also been a key indicator that we have focused on previously, and ensure that staff are supported when feeling stressed and anxious. Since its highest in February, so the graph on page 17, since its highest in February, it has started declining. You will note from that graph that the children's area has seen an increase over the 12-month period, which you can identify from that. So again, that might be an area of interest. As we're in the pandemic, I thought that the committee may wish to know the council's COVID-related absence. So there on page 18, there is another graph. This shows head count, so it's not in the FTE 12-month rolling period that you can see in the other graphs. So you can see from the peak of the first wave in April, which saw us about 88 staff were unable to work for COVID-related absences. So that's whether they were experiencing symptoms, told to self-isolate, or actually had a positive test. In those early days, remember that the testing wasn't as accessible as it is now, so there's not necessarily positive at the time. This did decline over the summer. Again, probably mirroring the picture from public health have given us around the national picture and York residents in general. And again, this is from October, we've seen an increase. So September of 9 individuals, there's 21 in October. And again, we probably expect to see this rising in line with the potential national picture as well. I'd like to provide the committee the assurances that once a member of staff reports absence, so through that day one absence system, it's picked up by HR in real time. So as soon as that comes through, we get the information within HR and we make contact with that individual straight away. And that's to make sure that they've been able to book a test or what are their circumstances. We also refer them on to our public health team internally, who make contact with them and do the necessary track and trace. And that would identify as well as if any other staff members are classified as a contact in which they need to self-isolate. So again, we're on that from that day one notification. So there's been a lot of joined up work across teams, HR, health and safety and public health, and we've made sure that the relevant advice and guidance is provided to staff and managers in a timely manner. Obviously, the government advice changes quite frequently, and we've updated guidance to reflect that changes. A lot of work around risk assessments, and obviously the new guidance that's come where extremely clinically vulnerable people are to work from home or stay at home. So again, we've updated that and contacted all of our staff who fall into that category. I've referenced the use of the day one absence systems. That's where the staff report into one line, the Medigold system. And that has been able to give us that real-time information to HR, which has been hugely beneficial. Developments to that system. So I think the committee were interested in the contract management of that and the outputs of what that contract signed up for. And obviously, and I think I was due to come back at some point during the year on a kind of update to that. Some of the development was put on hold during that first lockdown. Obviously, all hands on deck in terms of providing the response to the pandemic. We are rolling out this month the next stage to that, which is stage management. So we are still developing it. It is giving more of that real-time information to managers to help them really support and manage absence and ensure that staff are receiving that necessary support. We will need to make a decision in the new year regarding that contract renewal. We signed up for it for 2 years, executive approved it for that 2-year period, which comes to an end in September 2021. So again, we'll need to make a decision relatively early in the new year. Some new activity then moving forward that we're introducing from a health and wellbeing perspective. We launched this week a staff buddy scheme. So staff who may feel isolated or who want to support other members of staff can sign up to be part of the staff buddy scheme, where we'll pair people up and they can have those informal chats and contacts, not necessarily work related. A peer network for our mental wellbeing support and development, and we're doing lots of virtual drop-in sessions for staff and managers, so again for them to talk to HR direct, ask us anything, or if there's any specific themes, we can run some of those sessions. And then updating the home working guidance as it changes. I think Ian's mentioned people are working at home. We have seen an increase of staff requests to come back into the office, which we've seen since probably August time when the first lockdown ended, and we have they're assessed on a case-by-case basis, where they if they need to be back in an office because their work environment at home or health and well-being, they need to be back in the office, then we've approved them. So we have seen an increase but we are trying to still keep that to a minimum to ensure that the people that we do have back in the office are then in a safe environment and COVID secure. Do you want me? I think I was going to leave it there, Chair, and open it for questions.
Yeah, no, that's great, and thanks a lot for the presentation and also the report. It was a really helpful report with a lot of stuff to go on. I know I've certainly got a few questions, but Councillor Rowley, as ever, seems to have got in very early with his question. So I'll invite him, and then if anybody else is wanting to ask questions, if you could indicate now.
Thank you, Chair, and Judy, as always, thank you so much for your very informative report. And again, thank you for the work you're doing under these really difficult circumstances in terms of managing HR. I just want to come back to the page 16 report about staff absences. And again, I'm not in any way casting aspersions upon any member of staff, but you know, in a conventional way, when you go into work, if you're not well enough to go into work, you make the decision that you're not going to go into work and you call in that you're going to be sick. Again, if you are working from home, unfortunately I can't work from home in my job, but I guess if you are working from home, if there's, are you less likely to take the day off sick if you've got something that you can do, but maybe not be 100%? And is that, you see where I'm coming from? I'm just thinking, how do we monitor and how do we report these sickness figures, when people are working from home? And my other question, really sorry, so it's not a supplementary, is prior to the second lockdown that we had, what percentage of the workforce that would normally be in West offices were back in West offices? So 2 separate questions, but there'll be no supplementaries.
With regards to the our staff less likely to take a day sick because they're working from home, possibly not. I think it's hard to make that judgment call. You're right, some people, and I suppose it's different people, isn't it? Some people will come into work regardless and kind of work through when maybe they should be at home, and others may not come into the office to start with. It's probably reflects the same at home. I think it's difficult, Councillor, because we just wouldn't have that information. I would expect where managers are aware that members of staff aren't well, then they should be told not to work if they're not well enough to work. So it's that bit about if you're not fit to work, then you shouldn't be working. And I'd expect the managers to have that discussion with individuals, and then they would report sick. We'd never be able to capture whether you're not feeling well, and if you'd have been in the office, would you have took a sick day? I don't think we'd be able to answer that one. With regards to so in West offices, we were averaging only around 100 people on any one day. The COVID, you're going to test me here, and I'm sure I've written it down in a report somewhere. So estimated, a bit of a guess. The COVID secure number for West offices is around 420 people. Pre-COVID, I think it was around the 900 mark. There is a lot more people working down at Hazel Court, obviously, because that's our frontline service buildings, and we do have people in terms of social care out in the community as well. So that kind of 100, I say, for West offices doesn't reflect the whole workforce that's in a workplace.
Thanks, Trudy. Councillor Kilbane.
Thanks, Chair. Thanks, Trudy. Thanks for all the work you're doing. It can't be easy to manage personnel remotely. I'm just checking my own figures here. In terms of the page 16 of the report, are we saying that for the average employee, if you go across all the different departments, that on average people are taking about 11 days a year off sick? That's about right. Okay.
Yes.
And if you're working in education, then it's over 4 days per year. There's a couple of questions. One is there a particular group within that sector that is suffering from stress that's causing those stress absences? And the other question is, what are we doing to try and tackle the cause of the stress?
So we can't see that detail from these graphs, obviously, and apologies, it was put together quite quickly. Again, if that's an area for us to look into in a bit more detail, then I can take that away from this meeting. We had started some work prior to COVID regarding kind of stress and mental health, and what are we doing, and what's best practice out there. I know Councillor Crawshaw and I and Councillor Fenton were due to set off on our travels, meeting lots of people, which was put on hold. So again, if as a committee you want me to have a look at that in a bit more detail, then I can do a little bit of the digging.
So I've got Councillor Kilbane and Councillor Musson both indicating for a supplementary. So I'll just go to Councillor Musson if I can first, because she's spoken less than Councillor Kilbane, but I will bring you in, Councillor Kilbane.
Thanks. Yeah, I think my question was just about with the stress sickness reporting. I generally find it's really helpful for us to tell what is stress reported absence, and within that what is reported as work-related stress, because I really do feel that that's quite a significant distinction to make in terms of our responsibility as an employer and the conditions that people are working in, particularly at the moment. If that information is to hand, I think if we could have that separated or broken down in future, that would be really helpful.
I'm not sure it is. I don't think it's separated out as a separate reason code, but I will go away and have a look at that.
Thanks. And Councillor Gilbane.
Yeah, that would be very helpful, following on from Councillor Muson's suggestion, just in terms of tackling the stress, really, because I see a lot in the report about dealing with the symptoms and picking people up once they're suffering, but obviously identifying the cause and dealing with it at root would be the best way to tackle the problem. But if you're on with that, that's great.
Yeah, I think Councillor Fenton and myself and Trudy had a quite a nice trip out to North Allerton to speak to North Yorkshire County Council, and then myself and Trudy went to Hiscox. I'm not sure whether we managed any other visits, but there were certainly ones lined up before, and I think it would be good to continue that piece of work as and when we can do, because I think that was, you know, an important piece of work that I'm certainly keen the committee comes back to. Councillor Pearson, I've got you next.
Thanks, Chair. Thanks, Trudy, for your report. My question is really about what support is available for managers. I notice in paragraph 24 in the table there that you've got things like virtual drop-in sessions for managers. And I just wonder, what has the take-up been for this kind of support, and is there anything more that we can be doing to ensure that obviously managers are managing well? And I suppose my second question, if I may, is just about the staff survey and what the response rate was like last time, and what we're doing to promote and encourage people to respond to the staff survey this time.
Yep. So in terms of managers, so the manager drop-in sessions, which were just a new idea, has had a really positive response as soon as we've sent the email out. So it's the intention that the HR team will continue with those regular drop-in sessions now going forward, and it's obviously made a little bit easier from the virtual world, because we're not having to find room bookings and all of that. So we will continue on with them. Prior to that, we've done regular emails out to managers. They can contact the HR contacts themselves, the HR emails. Ian's the Chief Operating Officer has run regular leading together sessions, which is all of kind of heads of service and above, and some of that information gets cascaded down. I send out key manager emails, really from just a HR, what you need to do about managing staff and what are the important bits. So I think we've done a lot. There's guidance there around how to manage staff kind of home working and things like that. So there's lots of bits out there, and we've got my HR teams are in regular contact with managers as well. So we do pick up any issues or themes as they come through. With regards to the staff health and wellbeing survey, now I think I came in July with a report on that. And the response rates were I can't remember what the figures were, so apologies. The response rates for the health and wellbeing survey that we did in lockdown was higher than what we'd had in our previous staff surveys, so it was very well received. Not saying that we can't improve that. So again, we will be trying to increase the messaging, and we have asked, and nobody's come up with the magic solution of how we get more responses, and especially from our frontline service staff, where they don't necessarily have access to the computers, and we've tried everything. And one we will look at is whether we can use iPads, etc., to increase that. So we are working on it. If you've got any creative ideas in terms of getting more people responding, then myself and probably the rest of the OD community would love to hear it. Oh, we might have a suggestion.
I just thought, Ian will cringe when I say this, but actually we've offered cash, because actually, you know, finances and things do drive people sometimes, or maybe not cash, but an alternative, a voucher or something like that.
We have considered that, and it was discounted in previous surveys.
That's interesting. I think that is quite a well-regarded way of getting a higher take-up of of survey responses. Is whether it's a cash or a voucher or something that gives you a potential gain. I think the other thing that we've discussed as a committee previously as well around take-up is that is how do you contact the people who feel they don't have time to be able to complete the survey because they're so stressed and, and running around, so I think that's important. And certainly one of the things that I just wanted, I will bring you in a second, Councillor Rowley, but I just wanted to just pick up a question which related to the survey, because I think the third box down on page 14 says 58% of staff are coping well or very well, which is great. Presumably that means that 40% are either not sure or not coping very well. And I just wondered what we've done or been able to do to try to reach out to any of those staff who may have completed a survey saying that they're not coping particularly well, to either signpost them to support or try to understand a little bit better about what it is that they're struggling with.
Yeah, so that was the detail that came in the last report in July. And directorate management teams took away their results, and there was more breakdown in terms of those areas. Obviously, it's confidential in that we can't identify any individuals, but directorate management teams did do additional work around those responses and ask for people to feedback comments and feedback suggestions. So again, I can update you at a further meeting on that, or we can wait and see the comparisons to the new survey and kind of what's going to happen.
Thanks. I think it's perhaps something that if you could send something through to me about what things have been picked up, and then I can circulate to committee and we can decide whether we want to spend more time on it within this forum. Councillor Rowley, I think you had a supplementary on this as well.
It was just an idea, Chair, for Trudy. Trudy, how about giving some people incentive to return the forms by giving them their birthday off? I know we do that with our staff. None of them work their birthdays, and I know there are firms that use that as an incentive. So
it's certainly a nice one. I'm not seeing anybody else indicating that they have questions to ask, but I did have a couple of things that I just wanted to pick up as well from the report. So just bear with me 1 second while I orient myself. The first was just around the table on page 17, and you noted already the rise in sickness within children education, and that seemed to have started sort of around October, possibly September time. I just wondered what information what have we done to look to see whether there was anything that's instigated that rise in sickness, and again, I fully appreciate that you can't talk about individuals, but is it a rise that is a sort of a cumulative rise because you've got a small number of individuals having long-term sickness, or is it a sense of there being a greater number of individuals taking perhaps only 1 or 2 extra days than they would normally do? But what level of detail do we have around that at the moment?
So to hand, I don't have that information, but we would be able to get that information. So I can work with Ian Cunningham on that in terms of detailing the kind of numbers or what's making up that increase in children's.
Thank you. Councillor Musson, was that a supplementary?
It's sort of a supplementary point almost on that, and it follows on for what Councillor Rowley was saying earlier about how in the working from home times you might not call in sick to work because you're just sort of working behind a screen and you feel like actually you can push through it a little bit. And I actually think there's a couple of industries or work settings where you might have actually gone into work despite feeling unwell in a normal situation because it's just a mild cold. But actually now you can't and you shouldn't go into work if you've got cold and flu symptoms because you have a duty to stay home if you could be COVID positive. So I think that's also a consideration, especially potentially in childcare settings. It's a very anecdotal point, but I have spoken to people who wouldn't normally call in sick but have been doing that multiple times because they've had cold symptoms.
Thank you, Councillor Musson. The other question that I wanted to just sort of ask you about was page 18, paragraph 19. It just refers to this, continuing with staff working from home wherever possible. And I know that one of the issues that we've had around absence in particularly things like waste services and some of the physical things, has been around musculoskeletal problems. And I know certainly I'm sat at the moment at my kitchen table looking at a laptop that I'm slightly hunched over, and it's not the best kind of workstation environment because I don't have an office at my house. And I'm sure that I'm not alone in terms of members of staff who are perhaps working at computer screens that aren't set up in the most ideal way. And I'm just wondering what we've done, again, proactively to try to ensure that staff, wherever it's possible, have got a decent sort of home working setup, because what we don't want to do is create sort of further absence problems down the line because we're all kind of working in slightly ad hoc arrangements at the moment.
Yeah, so that was one of our key areas of focus as well in the early stages. So around making sure that people had the right IT equipment to be able to do their job and the right setup. That doesn't mean that everybody's expected to have a full home office with movable chairs and monitors and everything as can be provided in the office, but it's about putting that about doing that risk assessment and staff taking responsibility themselves. So if you're sat on your computer, make sure that you've done your DSE assessment and set it up correctly as we should do in the office, and also make sure that people are taking breaks so that you're not hunched over your computer at times. That's around, we've pushed that in guidance to both staff and to managers, making sure that managers are having those conversations. And we know they're happening because the staff where staff haven't got that right set up, then the requests have come back to the workplace readiness group to be considered to move back into the building. And we pick up at that point, that's got IT on that, and health and safety and others. So where there's any kind of flags there, that we pick up that as well to make sure that actually, is it an IT issue or is it a setup issue, or do you really need to be back into the building? So I think an awful lot has been done. That's not to guarantee that we're 100% everybody's sat in the right work kind of setup. I mean, I have the chair, but I'm probably still hunched and I shouldn't, and you kind of so some of it's about personal responsibility as well as the organisation. We have lent out, or lent out, I was going to say rented, but we're not charging, lent out about 350 chairs from West offices. So there's about 350 staff that have come and collected chairs. So we've got they're in a better chair setup. So whilst they may be at the kitchen table, that they're in a fully supported chair, which we continue to do. So if people need them, staff have been in, and we've got raisers for some staff, and the footrests have been lent out as well. So as and we, to be honest, we did another push on the DSE assessments, I think it was last week, encouraging staff to go onto the new health and safety online system to do it on there, and managers to then have those conversations with those members of staff about the setup. Again, we're encouraging, and it is down to good management, that they should have these kind of conversations and visible chats, so you can see kind of how people are sat. We did, I said, when the first lockdown lifted, there was a few staff that were in 1-bedroom shared houses, sat doing work on the bed so again, where they wouldn't have capacity to get a desk or a chair, and therefore actually those staff need to return to the workplace for health and well-being. So I think a lot's been done and is ongoing, and reminding staff as well for their responsibility and making sure I mean, when we use hot desks at West offices, we should all go in and set it up properly according to the DSE guidance, etc. So it's about staff taking responsibility as well as being supported by the organisation.
That's great, thank you. I'm not seeing anybody else ask with their hands up. I have just got one further question. I'm aware I've asked you a whole bunch of questions, but I did say you did put together a good report with a few questions for me in it. So I'm going to make this the last question. It was just to take us back to the day one absence reporting and the contract with Medigold, and I think you said that it's up for reprocurement in September, and so it would be early next year that we'd have to start having that conversation and thinking about it. And I think when the contract was first being discussed, there was some challenge as to whether or not it was appropriate to go out to an outsourced contract, or whether it was something that actually would be better spending the resource training managers internally. And I recall at the time that part of the thinking was that this would be a way of changing the way that managers might manage things, and that we therefore wouldn't necessarily require an extension of the contract at the end of that 2-year period. And so I guess what I'm seeking really is a bit of reassurance around what we're going to do in terms of reviewing whether or not we actually need to outsource that contract, and whether or not that is the most appropriate use of money. Because I think from memory it was about £180,000 the original contract, and so I assume it'll be a similar ballpark if we go out again, and given everything that we know about finances internally at the moment. So I guess what I'd like to just understand is a little bit about if I've got the timeline right, what the decision-making process will be, where the opportunity for input might be, possibly whether it's appropriate for this scrutiny committee to consider different options if there's a decision to be made, and perhaps make our own recommendation to whoever the eventual decision maker might be. But as I say, I would be anxious if we just went out and re-procured from Medigold to get the same thing again without considering whether that's still the best option.
Yeah, so I agree. So we need to review the full process really, and what it was. You right, Councillor Crawshaw, in a sense of we said that the whole plan was for us to change the culture in a sense around how managers manage sickness absence and absence management, and how we get them more involved and picking up on that kind of day-to-day stuff and managing it effectively through that. So I will be saying I'm asking for a full review of it being done in terms of an options appraisal about where we go with it. Conscious of the money spent, you're right, it was 180,000 for the 2 years, and in the current climate, it's got to be value for money if that's where we were looking to spend it, if it would be approved. So that detail will be done, and I've already got the team looking at that. We've obviously lost with COVID, as other projects, we've lost a good kind of 6 to 9 months of kind of development and culture change and process change around some of that. So that's not to say that would therefore mean the only option is to extend, and I'm not in that place. In terms of approval process, my understanding, I'll be writing that report to go through to CMT for discussion and onward transmission from there. It was an executive decision last time, so I'm assuming that if we were to spend the money again, it would be an executive decision. In terms of how it fits in with scrutiny and others, I'm probably not best placed to. Might need Janie's help. I'm not great on the governance side around kind of all that decision making and where it goes first or last. I'm
just conscious that it was a called-in decision last time,
yeah.
and I think it would be helpful if we could avoid it reaching that point, and if that means having some pre-decision input through perhaps this committee or otherwise, then that would probably be preferable, I would guess, than it going to a decision session and then being a called in and yeah. delays to the process and what have you.
Yeah.
But no, that's helpful for that update. Yeah, thank you. What I'm going to do now is just have a think about, because we've obviously had quite a lot of things in there, and in your report it was very helpful, just giving us some suggestions for areas for further consideration. So members, it's page 21, paragraph 32. There was some recommendations or suggestions that Trudy had made, and I think I would agree with the first around considering the results of an ex-staff survey and whether we want to have a think about bringing that back to this committee as and when that's been completed. So I'm just looking around for members if you can give us a wave or a nod if you are agreeing that we should do that. Yeah, I think that's broadly supported. The second bullet point, I think my inclination actually would be to just separate it out slightly, and I think the stress and mental health of staff in the workplace as an issue and what can be done about it, I think was a piece of work that was already ongoing, and my sort of sense would be that that's something that perhaps Councillor Fenton, myself and yourself, Trudy, might look to just pick up that piece of work as and when we can, because obviously I think we're still going to be restricted in terms of visiting people. But I'd be keen that we do that but I also think that we ought to be asking Children Education Scrutiny Committee to look into the specific circumstances around what's happening with the rise in absence in that directorate. So again, if members are happy with that as an approach, Councillor Musson, I can see your hands raised, and I don't know whether that's, did you want to make a comment on what I'm saying? Or
it was just the third bullet point says to consider what other authorities do to support well-being, and obviously I agree with that, but it might be worth expanding that to other large employers if we think there's an employer, like, I know you've already visited one, but it seems like there might be other places that would also do good things and best practice to be shared with.
Yeah, I think that certainly was our intention originally, was that we'd look at both public and private sector, and looking locally, I think we'd approach the university, I think, and I think with the North Yorkshire Police we'd talked about going and speaking to, and certainly, as I say, I'd visited Hiscox and possibly had others. Trudy, I don't know if you...
Yeah, we had Nestle and others kind of around York in a sense of the private sector organisations. Yeah, I just missed that from the report.
Yeah. So if we take those three bullets as things that we'd like to look at, and I think I'd also like to add that Scrutiny has some input as appropriate around the day one absence and the Medigold, or whatever the reprocurement of that day one absence services. And again, I'm just looking for members to give us an indication that you think that that's pushing in the right direction. Seeing nods, great. So unless anybody else has any other points that they wanted to raise on that, it just leaves me to say thank you very much to Trudy for coming, and apologies. I know you had to put this report together quite hastily, and you know, I'll hold my hands up on that. It was a slightly late notice request from me, so you know, thank you very much for your time this evening.
Thank you very much. Goodbye.
That's great. See you later on. Now, I'm conscious of time, and I'm going to take a straw poll. We could either have a very quick 5 minutes now, or we could go straight into seeing Debbie and then on to the work plan and plough on through. So anybody in favour of a quick 5 minutes now, or is that a 2 minutes, Pete? Quick 2 minutes? Okay, what I'll suggest we do is we switch off our video feeds and we come straight back in at 7:30. Right, welcome back, everybody. I'm going to move us straight on to agenda item 7, which is the finance update. Councillor Rowley is just going to be leaving us for 5 minutes, so he's going to be switching off his video feed and will be joining the meeting again in just a few minutes' time, when you'll see him reappear on your screen. But we have got joining us on our screen now Debbie Mitchell, who is Head of Corporate Finance and Commercial Procurement, and is also the Council's newly appointed Section 151 officer. So congratulations on your appointment, and if you could give us a quick update on your report, and then I'll invite members to ask questions.
Yeah, sure. Good evening, everyone. I think it's fair to say a number of things have moved on since this report was written, not least my job title, which has now changed. But this report was written just before the Prime Minister made the announcement on the 31st of October about moving into this 4-week lockdown that we're in at the moment. So a number of things are out of date in this report, I'm afraid. We've not yet been able to assess the potential financial impact of this second lockdown on our key income streams, although there is an expected impact on things like car park income, so we're still working that through. However, the base position and the main message in the report does remain the same, in that we are experiencing financial challenge. We do need to take actions to manage that financial position and mitigate those pressures. But within finance at the moment, we are working on our medium-term financial plan, although it's very difficult given the current uncertainty. But we're in a position, I think, still of planning, hoping for the best, planning for the worst, which is never a satisfactory position to be in when you're planning the organisation's budget. Some of the other things that have been announced lately, such as the extension to the furlough scheme, are of course welcome. However, there is a feeling that that only delays or defers the problem rather than deals with the problem. So that's something that we're keeping a close eye on. Since I last spoke to you, we have been allocated a further tranche of COVID General Support Grant, so tranche 4, which was just under £1 million, 941,000, which was slightly disappointing actually. I think we were hoping for a little bit more. And I mentioned in the report around the at the time we were going into tier 2 and some of those funding streams. Again, that has been overtaken now by the national lockdown funding, and there are a number of funding streams, some of which you've heard others refer to throughout the meeting. So there, in terms of business grants funding, there is local restriction support grants of around about 5 million, and they are grants that are given to us by government to pass on to businesses. That's a mandated scheme, a national scheme with a level of grant funding that is allocated to those businesses. And there is also the discretionary scheme, which is called Additional Restrictions Grant, where we've received just over 4 million, so 4.2 million, and officers are working up a scheme at the moment for discussion. So that's work in progress. We've also received, I mentioned in the report that we were due to receive some contain funding, which we estimated at around 600,000. So that was at the time based on £3 per head. We think that is going up to £8 per head, but we are waiting for confirmation of that. So we've not yet had any allocation or correspondence from government about that. So that's an estimated figure. So we're awaiting some further information on that. We have had some funding, just over 100,000, to help us manage our clinically extremely vulnerable residents. And that again is being worked up through the hubs to offer kind of support and food and all those things that we did last time for those people that were shielding. So I apologise that I'm coming to you yet again saying it's uncertain and I don't know and all those kind of things, but sadly that is where we are. So I'll leave it there and just happy to take any questions.
Thanks, Debbie. And just to give you your proper full title, my apologies. I was sort of reading it off the sheet and then realised as I was saying it. So Debbie, you're the new Chief Finance Officer, aren't you? So I will open for questions, and Councillor Fenton was straight in off the mark this time. So Councillor Fenton, over to you.
Thank you, Chair, and thank you, Debbie. I just wondered, from discussions you might be having with colleagues in other authorities, is is there a kind of consensus view around how to plan ahead in the context of uncertainty? So I just wondered whether some authorities were taking a more kind of high risk strategy in terms of trying to plan ahead, or whether there's a degree of unanimity in terms of the sort of cautious approach that certainly we're taking in York.
I think there are a number of different approaches. I think the issue is it depends to some extent on what your financial position was like pre-lockdown. So if you were already experiencing financial challenge that has got worse, I know, I think it was Manchester actually this week have just released a report in terms of their budget planning where they're facing a significant shortfall, and some of the bigger Mets, I think we've discussed before the issues that Leeds are having, they're making significant savings. So I think we're all in the same boat in that everybody is hoping for the best and planning for the worst. A number of councils are looking at uses of reserves, and a number of councils have already embarked on fairly significant transformation exercises to look at the kind of future shape and size of their council and a fundamental review of what the council is for. So there are some that have moved more to that radical end of a fundamental redesign, but they tend to be those councils that were perhaps had a more significant financial challenge before. Those that were like us, where we're reasonably robust and had a good kind of financial process and a strong budget, are to a certain extent, like us, reliant on the strength of the recovery of our local economy. But also, I've yet to speak to a council who is doing anything different to what we're doing in terms of cost control, managing vacancies, managing expenditure really carefully. But I think it's fair to say we are all in the same position of waiting to see what further announcements come from government in terms of funding. My view is we can't wait indefinitely for that. The spending review, as again we've discussed here before, is due later this month. I think the 25th of November actually is the date that they've given us. We shall have to wait and see what additional news the spending review brings, if any. But I've yet to see anybody that's doing anything particularly different to us.
Thanks, Debbie. Councillor Musson.
Thank you, Chair. Oh gosh, my camera's gone all funny. It should be fine now. And thank you, Debbie, for the report, and congratulations on your appointment. I wanted to ask a question about the isolation payments, and I appreciate that the bit in this report is kind of overtaken by the lockdown, but I'm just going to ask the question assuming that we're going to come out of the lockdown in a similar position to where we were when we went into it. I guess my question is that there's £66,000 for people who qualify for benefits and 39, just under 40,000 for those who don't, which means that we can give the £500 award to 132 people who were on benefits and 79 who aren't. Do you think that would be enough in the hypothetical that we wouldn't have been in lockdown in this month? And if we're going to get a similar amount when we come out of lockdown, if other schemes aren't available, I guess what I'm asking is that enough to support the level of take-up we expect? Because that just seems like quite a small number to me. You might have information that says that actually it's not worrying at all, which I'd be grateful to hear, but it just seems quite small if that's all we have. And do we have the availability to move other money towards that if we exceed that number?
Yes, I thank you. Yes, I agree. We thought the same when it came that that there was maybe a number missing somewhere at the beginning. That I was quite surprised as well. That the latest information that I've got, let me just check. We have spent about 30% of those funds so far. So I'm just trying to read a report at the same time. So the government, I think, there's a chance that they will give us more if we can evidence that. I think from our point of view, we're keeping a very close eye on that, and at the point that that money runs out, we do also have the York Financial Assistance Scheme, which is there to support people with support in terms of buying food, buying essentials, all that kind of area. So I think we have a very good system already in place as a backstop. It will all depend, won't it, on how many people are required to self-isolate who are also on benefits and unable to work. So people are coming through the scheme, and yeah, we've spent actually we've spent just almost half of the money in terms of the standard scheme, and around about 75% of the discretionary. So we're well on the way with that. But I think that should we run out of those funds before the government makes another announcement, we'll use the York Financial Assistance Scheme to top up.
Thank you. Councillor Kilbane.
Oh, thanks, Chair, and thanks, Debbie. Just a supplementary to that, really, I suppose, is when you say to top up, do you mean still paying the £500 amounts out? Because I know that's not the way the financial assistance scheme works, is it?
Yeah, no, I mean not. I don't mean carrying on paying on the £500. I mean in providing those people with the support that they need.
Okay, thanks. And sorry, that wasn't my question, Chair, so that was a bit cheeky. I missed the bit where you said about the amounts of money going to the hubs and what that's envisaged to be spent on. Could you just go over that again for me, Tom?
That is the funding that we've got from government for clinically extremely vulnerable people. I haven't got the details in front of me as to how we're proposing to spend that money, but I can find that information out. That's gone into the kind of communities group for them to consider what is required. My assumption is that that will be used to carry on the work that has been done at the hubs, where they've been used to support those people that were shielding in the first lockdown. I don't think as many people now have to shield. I might be wrong on that, but there's a list of those clinically extremely vulnerable people, and that money is there to ensure that we can give them the support that they need, whatever that turns out to be.
Sorry, thanks. And what was the figure for that?
It was just over 100,000, so it's not massive. It's about 101,000. I'll have the exact number somewhere that I can email you.
Thank you. Councillor Musson again.
Sorry, I put my hand down and thought I'd wait a bit, but I didn't expect to be called upon again so quick. There's some stuff in here which, due to the lockdown, obviously the thing that it's supposed to be spent on can't, or wait, maybe it can, but it might need to be rejigged a little bit. So there's a grant there for reopening of high streets, which I assume is going to look different in terms of what that's spent on. I wondered if there's any room for manoeuvre in any of these amounts, if any of it is spent less than the amount that's stated there, whether it can be re-administered somewhere else in this list of things or on another thing, or if we then have to give it back. Apologies, I'm not as familiar with the rules about this kind of allocation.
Yeah, no, it's a fair question, actually, and it's one that I've asked myself. I think most of the things on that list have been spent at that level. Some of them come with conditions and some of them don't. To be honest, it's been really confusing because they've all come from different government departments as well, which is not helping. So some of the things like the reopening of the high streets, I think that has already all been spent after the first lockdown. So that was more of a historic thing. Whether or not we'll get more funding to support the local economy is just difficult to say. Some of the other areas like the infection control in care homes was all dished out direct to those care homes. Overall, there's still not enough money in there. I think we can safely say that. I think we've talked before about the amounts that we've spent and the loss of income, and it remains the case that it's the longer term impact that is causing me the most concern. So that is, I think, as I said earlier, the impact on our key income streams of business rates and council tax as we come back again, if there are any further local restrictions. So after this, at the beginning of December, is it going to go in a kind of a wave? Are we going to have a couple of months of quote unquote normal life? Are we then going to go into a 4-week lockdown again? A business is going to have to open and close. That's the area where it causes concern, and I think that's the area where it puts real stress on local businesses and then the impact on their employees who live in the city. So we are looking at where there are conditions attached and we have to give it back, then clearly we'll spend it on what it's been identified for. But some of the grants are what we call Section 31 grants, where it is a general grant. So the COVID support grant, the general support, the first line in that table is the best example of that. That is for us to determine that has already all been spent either on direct costs of dealing with COVID, compensation for the loss of income from key fees and charges. And I think, as I mentioned before, given that the staff time has been wholly occupied in dealing with the impact of the pandemic, there are then some other activities in terms of driving out existing savings that haven't gone as planned, and therefore we've got some shortfalls in agreed budget savings. So that's kind of all been accounted for, unfortunately. But yeah, we will look at that. We have got some more funding coming on the outbreak management and the contain. That may again all be required in order to deal with the test and the track and trace. But we are looking carefully at every grant that we get, whether it is all needed for that purpose and whether we can look at this in totality or whether it does need to be kept in separate areas.
Thank you, Debbie. That's helpful. I'm looking and I'm not seeing any further blue hands coming up on my screen. So I just had one question just right at the end of your report. And it was just really about how it might work in practice. So just in your conclusion, you note that government's announced that councils will be able to spread a deficit across 3 years. And forgive me if this is just sort of being a bit financially illiterate because I'm not an accountant, but my initial thought was, I think from reading your report, there's a chance, well, we're certainly going to be best case scenario £2 million down because of COVID. And so there may be a chance that we're pretty struggling to get across the line in terms of deficit or otherwise this year. And if we're thinking that the financial impact is going to be more significant next year than it has been this year and possibly ongoing, I understand that you might want to roll over a deficit over a year or two to try to avoid having to make cuts to services if you think you're going to recover along the way. But how do you see that option of being able to roll deficits across 3 years working in practice for us? And is it long enough? And is it going to actually do anything to mitigate against what feel like fairly devastating financial impacts?
Well, it's specifically in relation to the collection fund, which is where we hold council tax and business rates income. So and the government has issued some guidance on that actually just on Friday. So I've not been through that in any detail yet, but the team are looking at that, and it's very specific about what we can do and how we can spread the collection fund deficit over a 3-year period. So it's not a general approval to spread a deficit. It's only in relation to the collection fund, and it's got to be spread in 3 equal instalments, and it's very regimented as to how we do that. So we are just looking at that. On the one hand, I mean, I'm torn, quite honestly, because on the one hand it's a welcome concession that allows us to properly plan savings rather than making quick decisions that might not be the best decision in the longer term. So if you wanted to save money quickly, or do you want to save money in a sustainable way, they're often potentially 2 different ways. And essentially it just delays and defers the problem rather than deals with it. That's my main issue with it, really, is that it just pushes it into the long grass a little bit. And from a financial point of view, that's never something that we particularly advise to do. It's not something you would do in your own finances. You know, you've got an overdraft, I'll worry about that next year. It's just kind of not it's not very prudent. Having said that, if it's planned and we do it over 3 years, then you've got a plan in place, and you can clearly then look ahead and plan your budget over the next 2 to 3 years on the basis of knowing what that deficit is, and that you can spread it over 3 years. So it doesn't force you to make all the savings in 1 year. So that is a positive. But I would rather the government was actually saying that they would help us resolve that deficit rather than just allow us to spread it over a longer time period.
Thank you. That's helpful. I don't think I'd appreciated from first reading that it was just on the collection fund, but that's an important clarification. Thank you. I'm not seeing anybody else indicating, so I think it just leaves me to thank you again for your report and for coming to us. And I know when you were saying, when you were first introducing it, that everything changed since you published it, and I think we do sort of appreciate that it is an ever-moving situation, which is why it's been so good to have you coming regularly to the committee to give us updates and just help us sort of stay abreast of things. So thanks again for your time this evening.
Thank you.
Thank you. So I'm going to move us on to agenda item 8, and I think we can probably roll in agenda item 9 within it. And what I'm going to propose that we do is try and guillotine the meeting at 8 o'clock, or as close to 8 o'clock as we can, because I'm conscious that it's been a longish meeting with a lot of things to take in. I just wanted to give you a very quick update on where we are in terms of scrutiny management and managing the work plan across scrutinies. So I've done quite a lot of work over the last month with Dawn and also Chris Elliott, trying to get a spreadsheet together that works in a sort of coherent way that anybody could come along and look at without knowing all the background to it to understand what it's trying to achieve. And I took that to the scrutiny chairs meeting last week, I think it was, or possibly the week before now. It's all sort of starting to blur a little bit. But I think that the general feedback there was that we were pushing along the right lines, and that this is an ongoing and evolving piece of work. So you've got in your agenda packs a sort of a big A3 printout, which is broadly speaking all of the topic areas that have been supplied to me and DEM services from either chairs of scrutiny committees, from the forums, from the previous work plans that were sort of pre-COVID that still seem to be relevant. And we've tried to collate all of that information together. And what we're doing is then looking at what things are coming up on the forward plan, when might be timely to be looking at particular areas, and trying to manage the work plans in conjunction with all of the different chairs of the committees, so that their quarterly meetings are managed and doing the sort of overview, but so that when we're thinking about commission slots and upcoming meeting dates, that we can make relevant requests for scrutiny, but also doing it in a timely way that gives officers time to prepare reports and hopefully starts to be a part of a constructive sort of relationship between ourselves and executive and corporate management team. So I feel that we're moving reasonably well with that and moving in the right direction. We've got health scrutiny that's meeting tomorrow, and they had done a piece of work around GP access, and you'll recall that came to our committee. We had a discussion, I think it was back in August, around GP access and what was happening in the city. That went back to the forum, and they had further discussions and have now taken that on to the meeting tomorrow, where they'll be working with CCG and looking at what is going to be happening over the next few weeks and months in terms of access to GPs and things there. So I think that's been a good sort of test case of how things might ping between the different committees and how we might look at things. And as I say, one of the specific things around that was being clear with that committee that we'd already looked at some of the retrospective stuff. We weren't interested in a review again of what was happening with GP access. What we're interested in is how GP access is being moved forward over the next few weeks and months. So I'm looking through the meeting diary at the moment, and one of the things that we're hoping to try and do is get agendas firmed up for everybody over the next few weeks and months, at least up until Christmas. You will have seen that we have got an additional meeting of CSMC. I sent out an email to everybody. So that's the 18th of November, and that's going to be looking at the strategic partnership document as part of the submission around the local government reorganisation. So that's 10 o'clock in the morning on the 18th of November. We've also, we're going to have a busy month of CSMC. We've also got the commission slot on the 23rd of November, which is looking at the asset management strategy. And that was done in conjunction with the assistant director and the exec member. And then we've got economy in place, which we're just firming up what the agenda is going to be for that, but looking for the 24th of November. And then moving on to the 1st of December, there is a potential for another commission scrutiny slot. And I'm conscious that actually this committee won't meet again before that slot would need to be filled if we were going to be using it. So we've got a meeting of the scrutiny chairs on the 17th of November. My proposal would be that we discuss within the scrutiny chairs whether or not there's anything that is sufficiently urgent to warrant commissioning a slot there. But my gut feeling is that some of that conversation that we had earlier around the community hubs and that kind of stuff is something that's relevant in terms of early help and support over the next weeks and months. So that's my mind. But as I say, that's to be confirmed certainly, and it's not something that I've discussed with anybody else. It's just in my in my thought process at the moment. And then obviously we've got our meeting of the 7th of December coming up. Now, one of the things that I've discussed with Councillor Fenton about these meetings going forward is the extent to which we want to be taking these regular updates from whether it's finance or whether it's public health or HR and otherwise. Again, my view is that finance and public health are both issues that are important that we keep abreast of in terms of our role as a committee, but also in terms of our role within scrutiny management. But again, I'd welcome views on whether there's anything else that we want as rolling updates, or whether there are particular areas that we'd like to look at more within our function as a customers corporate services scrutiny committee. So I will just take, I've got a couple of blue hands that have come up. I'll just take thoughts from people as a general steer. And as I say, any particular topic areas that people are thinking are important that we'd like to be looking into, it'd be just helpful to have a little flag from you all. So Councillor Fenton first.
Thank you, Chair. Just on the community hubs point, there's an informal children education and communities on days of today, Wednesday, when that's going to be the main agenda item. So it would be worth touching base with the chair of that committee on the back of that discussion as to what comes out of it in terms of a potential item for this committee. So that's something that is worth bearing in mind. I just say to thank everyone who's put in the work to get this up and running. It's a long list, but I think it's a starting point to move forward and have a more structured approach. And certainly as the chair of one of these committees, it's been really helpful to have that discussion with executive member and senior officers to really focus in on where as a committee we can add value. Yes, maintaining the challenge function, but also to focus on the policy development side as well. And we've got a number of things coming out of that, so it's a good start. Thank you.
Thanks, thanks, Councillor Fenton. And yes, I had in mind that there was this forum meeting happening this week, and that that might be why it might be an area for potentially looking at with the community hubs on that. Councillor Hollier.
Thanks, Chair. It was just on paragraph 3 of item 8. Talks there about CSMC assigning items to, those committee meetings, forums, commission scrutiny. I guess I'm just wondering a bit about how that process will work. Is it intended that, I guess, this committee discusses what items are on that sort of long list and then tries to sort of match up dates with with items, or obviously you just mentioned potentially the sort of chairs of committee looking at that one in December. I guess there's just a bit of a kind of transparency angle that perhaps it's better for those sort of decisions to be made at this committee where, you know, it's a public committee people can see, rather than necessarily the chairs of the committee one where it's not a sort of public meeting. So I guess there's that point, but I guess it's just a bit of clarity around the way that would work, because we're going to continually come up with this sort of problem where we're not going to meet in the period between, you know, a period and when there is one of these commission slots or whatever. So just a bit of clarity about perhaps how we see that working would be welcome.
Sure. So my first thing I would say is that this is a bit of a work in progress, and we are trying to catch up with ourselves slightly. So as Councillor Fenton mentioned there, you know, we've got a great big long list that what we're seeking to do is reduce it down and also kind of be clearer about where the priority lies with things. So one of the things that I'm not sure whether it's happened yet, but it's certainly due to happen, is that this long list is due to go to CMT for them to fill in their part of the document, which is around when they anticipate a decision needing to be made and who they anticipate the decision maker being on any of these areas, or if indeed they expect it to be something for which there is a decision to be made at any point in the future. I think that broadly speaking, the way that this will operate is a little bit as Councillor Fenton has alluded to, that the chairs of the committees will be discussing their work plans within their committees and with the portfolio holders and the corporate directors and others, and will be coming forward with suggestions of essentially making a pitch in a way for saying, we've got this item coming up on the executive agenda in so many weeks' time, and we think that would be good for pre-decision. Or here's an area that we've identified we don't currently have a policy around, but it would be helpful to develop a policy around this particular area, and it's not urgent, or it's very urgent, or whatever it might be. And then I think that once we have a series of potential items that are all ready to go for commission scrutiny, and again, this is where I think it's a bit of a work in progress. What I'm envisaging is that we will end up with a situation where we might have 2 commission slots available over the next 6 or 8 weeks, but we might have 4 topic areas from different committees that are all but basically good to go, all have reasons for or against, or you know, priority issues, and then we as a committee will be looking at that and saying, right, actually we think that this is the highest priority at the moment. So a little bit of that happened at the last meeting, if you recall, in the sense that we came forward with 2 different topic areas, one being the housing, one around antisocial behaviour and what have you, and the other being around the asset management strategy. And we had the 2 slots available, and we said, these are the 2 areas that we're thinking of commissioning, and is everybody happy that that's the route that we take? Now, what I would envisage longer term is that we might have more than 2 potential routes to take for the 2 potential slots. And we might be saying, actually, we've got more of a decision to take here about which way we go. But it's a bit of an iterative process, and it's about trying to manage the resources as we have them to be as effective as they can possibly be, acknowledging, as I think we all do, that we're limited at the moment in terms of just how much scrutiny we can do, just how much policy development we can do within the climate that we find ourselves in. So I hope that sort of speaks to some of what you're getting at. But as I say, that it's certainly a process that I'm hoping is about a dialogue and about people feeling able to say where they think that something could be improved, or where something is working well or not so well. Any other comments from anybody else at this stage? Not seeing anybody else. Maybe to do with the time, I guess. I think what I will suggest that we do then is I'll be speaking with Councillor Kilbane about the agenda for Economy in Place on the 24th. and as I say, we'll have a conversation with Councillor Baker and the Scrutiny chairs about whether or not the 1st of December, that's the most appropriate thing to take to that slot, if indeed we choose to use it. And then I think what I would hope that we will do is come back at the next meeting with a clearer sense of how some of these policy areas are ranked in terms of urgency and in terms of priority, and that will be with input both from the corporate management team and portfolio holders and committee chairs. So unless anything further needs to be added, I think that I will call us closed at this point. So just remains to say thank you very much to all of the technical staff who've facilitated the meeting this evening, and all of the officers for all of their input, and thanks to yourselves, and have a good evening.